Welcome back to another day opportunity for health accumulation. So, do you have digestive complaints? Do you feel like food just goes right through you? Do you feel like your meal, sits like a rock in your stomach? Like, oh, just bloated after eating meals. Are you having lots of gas, bloating? Is that just like a regular part of your life? Like, what would life be like without gas and bloating? I mean, who doesn't have that? You know, and or also, are you running like 100 miles an hour every day, in 14 different directions? Do you feel like you're putting out, all this crazy amount of energy into life and you're just putting out fires in relationships and work and you name it nonstop? Like you're just like stressed out all the time. Well, you may have guessed it, but potentially, likely, the digestive symptoms you're having, the complaints you're having there, are directly related to the stress and the lack of well-being you're experiencing in your mental emotional life. And this poorly metabolized stress that you're under the burden of, that could be why your digestive system feels like it's just not doing what it's supposed to be doing. And I've literally lost track of the number of patients who come in experiencing years and even decades of digestive complaints, discomfort, things just not working like they're supposed to work, going weeks and weeks without having bowel movements. And when we go back through their history, we're able to identify a particular life event or a life circumstance or a group of circumstances that occurred just before the digestive complaints started presenting themselves. And this is not by accident. This is not like, it just happens that way. No, the digestive system has a nervous system called the enteric nervous system, and it is directly related to our feelings of well-being and our feelings of security. So there's a 2018 study published in the Frontiers of Neuroscience that demonstrated that stress inhibits this nerve, this big old cranial nerve called the vagus nerve, that comes from our brainstem, innervates our digestive tract, our stomach specifically, that it impaired the vagus nerve. And this was strongly linked to digestive disorders ranging from irritable bowel syndrome all the way to inflammatory bowel syndrome, or inflammatory bowel disease, such as like ulcerative colitis, Crohn's disease, all because this vagus nerve was impaired. And our vagus nerve is basically like a superconductor of information that's all related to involuntary activities like digestion, like our heart rate, like our respirations. We're not thinking, okay, heart, let's beat again. Okay, time for your next beat. Breathe, it's time to breathe again. We don't have to think about that. Our vagus nerve just takes care of that stuff. And it literally is, it's like a highway between our digestive tract and our brain, this vagus nerve is. So if it is impaired, the relaxation response, which is imperative for optimal digestion, is not going to happen. Those activities are going to be shunted, stopped. No, nothing's happening here. And when that relaxation response isn't happening, guess what? Hydrochloric acid production is not where it's supposed to be. It's not adequate. That means that the stomach's not producing the gastric juices it needs to produce. The peristaltic movements that move food through the stomach into small intestine and down farther in large intestine, those aren't going to be happening. And there's just complete dysrhythm in our digestive tract. And digestion is compromised when we have maldigestion, we have lack of absorption, and our digestive system becomes irritated, inflamed, which, like I mentioned, in the end can potentially lead to inflammatory bowel diseases. Crazy, right? So, and when I say stress, this doesn't actually have to be purely my boss yelled at me or I'm cramming for a final exam, or my car broke down. What am I going to do? I lost my job. My wife's not getting along with me. These kind of things. It doesn't have to be purely psychological, mental, emotional stress. It can also be dietary choice induced stress. Consuming an abundance of flours and sugar-laden foods. Think like crackers, chips, candy, pastries, pasta, white rice, white breads, these kind of things. Pop-Tarts, how about those? cereals. The Journal of Nature published a study in May of 2021, and their research showed that a high processed carbohydrate diet, which are all those food items I just mentioned, also impaired vagus nerve function. So now, it's not just those external stressors, it's those things we're putting in internally into our mouth that are also impairing vagus nerve function. And what is the first thing people usually go to when they're under stress? In my experience, even myself, patients, family, it's usually those dopamine reward spiking foods, those high satiation in the moment foods that are high in sugar, high in flour, grain-based flours, that is, and things that are spiking blood sugars, just getting us, oh my goodness, I feel so much better, and then we don't. And this is rough, right? Because not only is digestion impaired by the going lifestyle and the stressors and external circumstances, but then the answer to that going is, the wider life is the refined, easy on-the-go foods. And now, not only are we malnourished because we're not eating nutritious food, which now drives even more stress in our being, and the stressors on the outside, the stressors coming inside, completely compromise our vagus nerve integrity, vagus nerve function, and now we're building, a deeper, essentially, cavern to try to draw ourselves out from, because of the cycle of bad comes in, bad comes out, and it's never bad comes in, good comes out. That just doesn't work. Like the Bible says, we're going to reap the fruit of our labor and the seeds we've sown. So, is there an answer? Can we help ourselves out? 100%. So for starters, it will require that we take a quick evaluation of our life, and if our experience on the digestive front and of our digestive distress, is there something circumstantial that led to this? And just be honest with ourselves. Evaluate. Okay, is the reason I'm feeling this way because of my dog is sick, or I had a car accident at this point, or I had these issue with this person in college, or I was under I lost my job, and geez, that's when my symptoms started happening. Evaluate, what is the underlying psychological potential stress-induced circumstantial factor that may have incited these digestive complaints, and then looking and saying, like, okay, what can I do about that? Is there anything I can do about that? Can I be okay with those circumstances, and moving on in life, and asking for help from counselors, friends, on how to see these things differently, or doing like brain retraining programming, something like that, or cognitive behavioral therapy, to retrain how we go about looking and the perspective we have related to the situation in our life. And so I know we often want like a supplement to take away our symptoms, get us past this, move on. But sure, probiotics, digestive enzymes, there's a lot of nutrients, what I'll even mention, that can benefit us. But all of these don't have first place, and they can help promote the healing response to the gut. But the real deal is getting down to, why am I in this situation in the first place? Why are my enzymes low? Why is my bacteria out of balance in the first place that I would even need to take a probiotic? What are the things in life that have led me to this state, especially on the stress front, on the fight or fight front? Like, what things are promoting fight or flight response in my body over and over again that would keep me from getting to that rest relaxation mode, which will allow optimal digestion to occur? So I would use an analogy such as this. If we don't look at our life and how we're viewing life, our perspective on life and the things that are happening in our life, then it's like taking our house is burning down and we got a super soaker, and we're like try to sure, we could take that probiotic, that enzyme, and that gives a little help, just like the super soaker might get some fire out in a particular corner of the house. But it's like, we could just go ahead and call the fire department, get them down here with all their big guns, their big water hoses, and clear the house out and get the fire out. And that's what it's like You're calling the local fire department to help you clear out the fire in your life by looking back in your life and saying, okay, what are the circumstances that led me, that were kind of going on when I started experiencing these digestive disorders, dysfunction, and be okay with the fact that, yes, man, I'm not handling stressors like I could be, or I should be, or I want to be. Now, how could I view this situation differently? And by viewing the situation differently, by finding a different perspective on that situation, you know what? That's going to help your vagus nerve out. All right, so secondly, consider your breathing. I know breathing, that's so old school. But if you're not nasal breathing, you got to start nasal breathing. Just got to get that happen. Because, I mean, mouth breathing, that is old school. That is not something we want to be doing, is mouth breathing. And I've talked about it so many times, but consider that your diaphragm, it's basically contracting like 25,000 times a day to enable breaths to come in, breaths to go out. And if we can get our diaphragm in a state of parasympathetic rest, relaxation, rhythmic movement, and out of a state of essentially tightness and tension and spasticity, then we can enable our being as a whole to be in a state of parasympathetic dominance, because our diaphragm really is like the main orchestrator of parasympathetic, sympathetic, the fight or flight versus the rest, relaxation response to our body. And if that's happening 25,000 times a day, well, what happens if we slow our breathing down, become silent breathers, practice on the way to work, while we're driving in the car, practice while we're standing in line at the grocery store, practice while we're sitting in the sauna at the gym. We practice becoming silent breathers and literally training this rest, relaxation response into our being, which is going to affect our vagus nerve, because it's going to affect our diaphragm. And if our diaphragm's on board, our vagus nerve will be on board. And if our vagus nerve's on board, we're going to get our digestive tract secreting better gastric juices. And if there's better gastric juices being secreted in sufficiency, we're going to break down our meals more optimally, which just goes all the way downstream and makes the entire digestive process more efficient, less gas, less bloating, less inflammation, and on and on. All right, thirdly, go outside in nature and move your body. If you don't already have a movement routine, what are you waiting for? Simply going outside and walking in your yard for like 5 minutes, that would do the trick. If you're already exercising and got stuff going, please continue doing those things. But if you're not doing anything right now, literally just getting outside for 5 minutes. Start your clock, walk outside, walk around in nature, in a natural lit area, and just allow that outdoor experience to produce a parasympathetic rest relaxation response in your body. Your body has no choice when you get in that situation to relax, compared to if you stay in a indoor setting with these bright blue lights just pounding you all day long. Natural light coupled with movement. This is literally the most underrated anxiolytic medication that is underprescribed nonstop. So you can prescribe it yourself. You don't need a pharmacist. You don't need a doctor. You can prescribe it yourself. Outside, 5 minutes minimum, walking around, just enjoying nature. All right. Fourthly, I would consider using probiotics, specifically like Lactobacillus family and Bifidobacterium family species, as these are very positive in studies showing their stress lowering effects on the vagus nerve and helping with the enteric nervous system, which is the nervous system of our gut, communicating with the central nervous system, which is the nervous system up here in our brain, and being very much that Lactobacillus and Bifidobacterium families being very much supportive of decreasing the stress response and lowering the effect or the spastic effect on the vagus nerve. So those are definitely something to consider. Number 5, look at utilizing adaptogenic herbs. If you are in a fast-paced world, I don't know how to get myself out of the situation, it's super tough. I just had a patient the other day talking about, they're boom, 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 traveling a lot, having feeling like they got a lot on their table. And yes, they got gastric pains, gallbladder pains, all kinds of different pains in their body, in their digestive tract, that is, that's negatively affecting them, and their vagus nerve is not functioning well. But yes, simply adding in while they're trying to change dietary stuff and that kind of thing, and change the perspective and create margin in life, adding adaptogenic herbs has been extremely helpful for them. And of course, one of my favorites is ashwagandha, but there's a lot of other ones that you can look at using or trying out, and these just help modulate our stress response and make us or allow us to have more margin for when circumstances are not exactly in our control. And then secondly, on number 5 here, is to look at using things like chamomile, licorice root, slippery elm, marshmallow root, green kiwi fruit, these herbs and fruits that basically heal the gut lining and can add a mucilaginous layer over the gut lining to allow the gut to heal and give it essentially give our gut itself margin from irritation. Those can be super effective. And then also, like chamomile, it's a nervine, so basically it helps modulate and almost acts as essentially an anxiolytic, an anti-anxiety herb for our enteric nervous system itself, the nervous system of our gut. So just remember, like I said earlier, using probiotics, using herbal support, while yes, it can be very, very helpful, it will not shine nearly as bright as it can and has potential to shine if you were instead to put your lifestyle adjustments, put your lifestyle perspective adjustment in place first, and then or in tandem, utilize the probiotics, utilize the adaptogenic herbs, utilize the chamomile, the slippery elms, those kind of things. All right, so I'm Dr. Matt. Hope this is helpful. I hope you get after it. I really hope you get after it. So what? I'm gonna get my digestive system right. I'm just gonna get it right. I probably don't need a parasite cleanse. I probably don't need to do another yeast diet. I probably need to figure out my external life circumstances and look at how I'm with the perspective I have related to them, and how I might be able to shift that perspective to help myself, help my vagus nerve tone, which will lead to better overall digestive activity, peristaltic movements, motility, and just decrease irritation as a whole. All right, I'll talk to you guys later.